The most frequent diseases of AIDS. In many cases, patients with AIDS do not die due to infection by the virus itself, but as a result of opportunistic infections or certain types of tumors. Infections develop when the immune system cannot protect the body against various infectious agents that are normally present in the environment and that under normal circumstances do not cause disease. The occurrence of any of the opportunistic, called AIDS-defining illnesses infections, together with the decrease in the number of CD4 T lymphocytes is what determines the clinical diagnosis of the disease. The more frequent in patients with AIDS opportunistic infection is pneumonia caused by Pneumocystis carinii, protozoa commonly found in the respiratory tract of most people. Usual association of AIDS with tuberculosis and other bacterial pneumonias. In the last phase of the disease symptom Mycobacterium avium can cause fever, weight loss, anemia, and diarrhea. Certain bacterial infections of the gastrointestinal tract can also present with diarrhea, weight loss, anorexia, and fever. They are also common during the advanced stages, the illness caused by protozoa, especially the central nervous system toxoplasmosis. Fungal infections are also common in patients with AIDS. Mucocutaneous Candida albicans infection usually occurs in the early stages and announces the onset of clinical immunodeficiency. Cryptococcus is the leading cause of meningitis who develop AIDS patients. Opportunistic viral infections, especially those caused by herpes viruses, have a very high incidence in patients with acquired immunodeficiency syndrome. Cytomegalovirus. Members of this virus family infect the retina and can cause blindness. Another herpes virus is Epstein-Barr virus, which has been linked to the development of lymphomas. Infection with herpes simplex virus, both type 1 and 2, is also common, causing perianal lesions and around the painful mouth. Many patients with acquired immunodeficiency syndrome also develop tumors. The most common are B-cell lymphomas and Kaposi's sarcoma. Lymphoma is a late manifestation of HIV infection and develops when the function of the immune defense system is very upset. It can affect any organ, especially the central nervous system. Kaposi's sarcoma is a multifocal neoplasm characterized by the development of vascular nodules in skin, mucosa, and viscera. Is an early manifestation of HIV infection and can occur with normal CD4 T lymphocytes. It is more common in infected human immunodeficiency virus and is common skin lesions of red or purple. Neoplasia patients.